Mark's life was obviously impacted significantly by this problem, as you can see by his emotional response to having some recovery. And in 2007, we pioneered Phrenic nerve reconstruction for the treatment of diaphragm paralysis. And over the last 15 years, roughly, we've treated patients from all over the United States and from many countries around the globe.
It's the best thing
that's ever happened in my life.
I mean, I feel a lot better now, and I can walk. I don't have any trouble hardly breathing on my job or anything like that. But I'm here just to say it is working, you know, and I'm grateful for Dr. Kaufman for doing this surgery.
That's pretty good. That's a simple test that shows you my improvement.
Very nice.
And also I'm breathing the proper way.
Yes.
I was breathing opposite
Exactly.
when I first came here.
Exactly.
I owe my life to Dr. Kaufman. I owe him everything. I respect him so much. I don't want to get too emotional because he means so much to me. And what he's done for me is he gave my life back.
A wise old physician once told me that it takes 25 years in medicine for anything to become standard. So we're getting there, but we still have a lot of work to do. We're publishing, we're lecturing, we're getting word out to the public. We really want to make this even more mainstream than it's already become. And that's the goal from here on in.